You know, it's no surprise that with everything going on, our mental health may be taking a hit, but luckily, our friends from Burrell wanted to send us some encouraging words to help us through. Take a listen.
Hello, Ozark Live viewers. My name is CJ Davis. I'm the President and CEO of Burrell Behavioral Health. Today, I'd like to talk a little bit about the state of mental health in our community as it concerns to the COVID crisis. Right now, we know through data that around 35% of Americans have a concern about their mental health. And that number has gone up over the past couple of weeks from 22%. And here in our community, we believe that that number is more around 50%. 1 out of every 2 of us right now is concerned either about our own mental health or a mental health condition or status of a loved one or family member. And you ask why? We're all engaged in what's called fight or flight right now. It's when you have to deal with a stressor. Your body either fights it or your body flees from it and runs. And that process is only meant to occur for a few hours at a time. And right now, what we are all doing is fighting for days upon days. And our bodies can't withstand that kind of prolonged exposure to anticipated harm. We are also trying to promote, and you've heard it in the community, social distancing. I really want to challenge the entire Ozark viewing area to change social distancing to physical distancing while remaining emotionally connected. And you may just think that's semantics and words, but let's talk a little bit about why isolation is so negatively impacting individuals in our viewing area. We know that folks that isolate tend to feel lonely, and we know that loneliness loads on depression. It's one of the hallmark drivers of depression in individuals suffering from that condition in our area. We also know that when folks feel lonely, they feel hopeless and helpless. And at a time like now, when we can't control our surroundings or what's happening in our communities, we all feel a little bit of hopelessness and helplessness. And we know that those factors also impact our increased use in substances. And more concerning is why we're isolating, while we're experiencing interpersonal loss as a result of less emotional connectedness and human connectedness. We are also at risk to see increased suicidal ideations. And we want to make sure that we head that public health crisis off. And in fact, right now, we know that about 17 million Americans are experiencing a depressed mood. And we also realize that 80% of those Americans, including the Americans in our viewing area, will not seek care. We also know from the data that online services in our country have gone up 65% since February, and that app use for behavioral health and mental health education has gone up 50%. I encourage us to remain in care as we are getting ready to embark upon a second public health crisis. There was already a mental health crisis occurring in our country, and now the added number of individuals experiencing anxiety regarding the COVID crisis has contributed to that increased volume and interest in behavioral health services. So you ask, how do we flatten that curve? We flatten that curve by encouraging people to engage in care. Engage in care if you experience any symptom that doesn't feel right to you from a psychological perspective. And for those individuals that are in care, remain in care. Burrell Behavioral Health has a crisis line open 24/7, and we also have the ability for you to engage in telephone services from the comfort of your home. We have to work hard to flatten the curve right now for the COVID crisis, and we also have to work hard to flatten the corresponding mental health crisis curve that will surge following the COVID containment. What are some of those symptoms you should be looking for? Worry, fear, constant anxiety, difficulty sleeping, difficulties eating. Those are all important risk factors. Of course, increased use in substances, irritability. From a kid point of view, those kids that have are more quick-tempered, as we're all sort of dealing with this together. I want to make sure that we're encouraging people to remain in care, encouraging people to reach out and stay connected to others, as this will end. We're all in it together, and we will see better days in the Ozarks. Be well. Thank you.